Hi, everybody. I'm Jane Claesgens, and I'm very grateful to be invited to speak with you all today at such an important event. I've been a patient at the Pancreas Center for 6 years. Prior to that, I was having many digestive issues, and it appeared that they were all leaning toward just having female problems. So my doctors at home were running some tests, and my gastroenterologist happened to remember that when I first met him 30 years ago, my mother had just passed away from pancreatic cancer. So he said to me, as long as we're doing all these other tests, why don't we just throw in an MRI on the pancreas? And a lesion did turn up on the pancreas. So at that point, my family and I started on our search for a specialist. So we had made a few appointments, and my brother actually got a recommendation for Dr. Chabot at a baseball game. He was sitting in the bleachers talking to his friend about what to do with his sister, me, and his friend said, well, Dr. So-and-so is on the opposing team over there, and he's the head of such and such department at Columbia. Why don't you go and ask him? So my brother goes right down the stands through the baseball field and goes up and asks this doctor, and he said, oh, take her to see Dr. Chabot. Well, that was the end of it. So that's how we ended up here. And we were so, so grateful for Dr. Chabot and all the help and care we got. Dr. Chabot felt that because of my family history with my mother having had pancreatic cancer, and there was and still is a question as to whether my grandmother had it or not, the records have been lost, that I needed to be monitored. So I was for a year with an EUS, and then 6 months later an MRI. The next EUS showed that there had been a change within the pancreas. So I had a distal pancreatectomy, which is the tail portion of the pancreas, was removed. I've been very grateful to be in this prevention program and relieved to have had these tests done regularly so that this was picked up so quickly. Being in this program has also given me the confidence that something will be picked up before it turns into anything major, and also it's enabled me just not to worry. I know that I'm in the best hands possible, and I'm very, very grateful for that, and so is my family. Here at the Pancreas Center, I received a personalized care plan, which is tailored to everyone's individual needs. Mine involves 2 tests a year, an MRI, and then 6 months later an EUS, each of which is followed up by an appointment to discuss the results. I don't ever think about the inconvenience of the tests, and I thought about this the last time I had the MRI. As you're lying there and you're hearing that banging noise, I thought, you know what, this is really nothing. I'm just so grateful that these tests are available to me so that if there is anything, Dr. Chabot and his team will catch it and act on it quickly, and it'll be taken care of. The minimum inconvenience of the test is nothing compared to being able to know that you have positive outcome and that you are taken care of and watched very closely. My personalized plan was based on my family history. My mother's pancreatic cancer, possibly my grandmother's, but also my son had melanoma at the age of 13. And at the time we were told that most melanomas don't develop until people have been exposed to the sun for about 20 years. So it was very unusual to have a child get it at that point. In talking to other family members after that, through the years I have discovered that my mother's brother had melanoma, and 4 of his children, who are all my first cousins, of course, also have had melanoma. So now I have 6 relatives with melanoma. Because of this family history, I did decide to go ahead with the genetic testing, partly for my children, for my brother, for his children, and for all my cousins. And my brother and I can only hope that our children, who are very much aware of this, will continue to be proactive about this throughout their lifetimes. Just as an aside, the picture on the far left is my grandchild. He's 5. And in talking to my daughter last week, I learned something that I probably heard years ago and forgot. My son-in-law, his father, lost his grandmother to pancreatic cancer. So my grandson has a maternal great-grandmother, mine, my mother, and a paternal great-grandmother, both of whom had pancreatic cancer. So he, of course, will, the family will be on his case. So, excuse me. Knowing this surveillance plan was set up due to my history makes me feel so much more confident in the diligence and success of this preventative program. As I said, I really just don't worry about the tests or any of this. My reaction is just relief that Dr. Chabot and his team have been so wonderful to me, and they will be there to catch anything if it should arise with me and my family. My care with the preventative program has always been very positive, very compassionate, and I've always felt grateful to be a part of the experience. I've been very appreciative for all the kindness and the expertise and the dedication that Dr. Chabot, Dr. Stevens, Dr. Frucht, Dr. Panaris, and Dr. Castrinas and all their associates have given me. So, thank you very much.